Hi everyone, my name is Lam, and today I will introduce my project idea for the clinical big data. My project is using big data to predict and reduce 30-day hospital readmissions. So I will focus on a fictional healthcare organization called MetroCare Hospital, which is a multi-specialty hospital in India. And the dataset I chose would be the India Hospital Readmission Dataset from Kaggle. And um, the main business problem is 30 days hospital remission. You know that some patients are discharged from the hospital, but they may return within 30 days because their risk is not identified early enough. So in a hospital setting, this can be a serious issue because different patients may have different level of risk, and it depends on their length of stay and their mission type, so on. So this problem is important because it affects whole patient and the hospital. For patient, being remitted may mean that their condition was not fully stable and they need stronger follow-up care after recharge. And for the hospital, remission can increase healthcare costs. It can create more pressure on hospital staff and it can affect care quality performance. So if the hospital cannot identify high-risk patient early, staff may spend more time and it would cost a lot. My solution is to build a big data pipeline that help MetroCare Hospital identify high-risk patients earlier. And I choose 30 days hospital remission because I believe that timing and early identification can really matter because if the hospital misses important risk signal, that patient may return within a short period of time, and none of us want that to happen. So I want to have to improve it. And this project is a good fit for big data because it includes the volume, variety, and velocity. In terms of volume, the dataset has 120,000 records. Um, in terms of variety, the data includes admission, discharge, hospital, and clinical data. And in terms of velocity, I plan to simulate real-time discharge event to show how the hospital could respond quickly when a patient leaves the hospital. And for my anticipated dataset, I plan to mainly use one file from the dataset, which is admission.csv. I choose to focus this file because it already have 120,000 rows and 17 columns, and it, it actually contains the core information I need for the project. Which is some important columns include admission ID, patient ID, admit day, discharge day, and last day. And this column will help me to understand when a patient were admitted, when they are discharged, and how long they stay in the hospital. The dataset also include operational fields such as admit type, ward type, hospital ID, and discharge type. And the field will help me explain the type of admission, the care setting, and the discharge result. And for clinical risk factor, the datasets include Johnson index, HbA1c, and so on. So the most important column for the machine learning use case would be the read 30-day, and this column will show whether a patient were remitted within 30 days. So it will be my target variable. And for the streaming use case, I plan to simulate real-time discharge event using record from admissions.csv, and each event can represent a patient being discharged from the hospital. The streaming query can check whether the patient has high-risk indicators such as long length of stay, ICUs, and if the patient meet the risk condition, the system can flag that patient for follow-up. And for the batch use case, I will process the historical admission data to create 3 dashboard KPI. The first one would be 30-day remission rate, which show the percentage of admission that resulted in a remission within 30 days. The second KPI would be average length of stay, which have the hospital understand how long patients stay before discharge. And the third one would be high-risk patient count, which show how many patients may need extra attention based on risk factor in the data. And these KPIs connect directly to the business problem because they have hospital leader monitor remission risk and follow up the needs. And for the machine learning use case, I will train a classification model to predict whether a patient is likely to be readmitted within 30 days. The model will use admission-related and clinical features such as length of stay, admission type, etc. And the model outputs will be a remission risk prediction that can help the hospital prioritize follow-up care. So I hope that my projects can help MetroCare Hospital reduce preventable remission, and I hope that it can help improve patient follow-up and make better data-driven decision. So, yep. Thank you for listening. Bye bye.